Minister Dr. Thobile Mbengashe has announced that South Africa's confirmed COVID-19 cases are now sitting at 35,812. The Eastern Cape has seen a big jump, surpassing Gauteng as the province with the second highest number of infections at 4,324. We're now joined by the Eastern Cape's Health Superintendent General, Dr. Thobile Mbengashe. Good evening, Dr. Thobile. It's a pleasure to have you on News at Prime tonight. Firstly, let's just then take a look at the Eastern Cape situation holistically when it comes to these increasing number of infections. What do you believe is driving it?
Good evening to you and your viewers. I think it's very important to say that in the traditionally rural provinces, with an extreme levels of disparities in healthcare services and extreme levels of poverty, with a total link with the other major cities, especially like Cape Town, the spread of infection, it can easily go and actually make a very similar pattern and a curve that is more like the Western Cape as we stand right now.
Sure. And are you finding that the pattern of outbreak is similar to what is happening in the Western Cape? Perhaps you can just break down where you're seeing the infections take place and how they're taking place.
Yes, I think what's very important now is that all of us, all the provinces had a big relief with the lockdown. The lockdown really reduced the number of infections that's happening in all the provinces. Eastern Cape as well, it actually gained from that. But what we know in terms of related projection and the modeling is that unless we do all the most important things of making sure that everyone wears a mask, we keep the social distance, and we avoid funerals, we avoid big events, and we actually avoid close contact, and we maintain social distance, we are unlikely to be successful in trying to keep the levels of infections down. So what we're experiencing in the Eastern Cape is that there's still a lack of proper acceptance of these controls, in particular funerals and big events, and these have been one of our drivers. The second area is that we have had a number of outbreaks in our prison services and in the areas where there are a number of people that are congregated in one confined areas, and these also contribute. Obviously, the movement of people and the urban areas where the economic hubs, those areas, because of the transportation, they have a high probability of spreading the infection. So our approach is to make sure that the JOC, which is the Joint Operation Committees, together with health, create a combined approach of a targeted intervention, testing, and isolation.
Funerals have long been flagged as being a potential super spreader events in the Eastern Cape. When you talk about other events, what are you referencing here? Because under the lockdown restrictions, of course, there should be little to no events taking place.
Actually, it's very interesting. When we opened up in the level 4 on the 1st of May, we had a huge influx of people from the other provinces, especially Western Cape. Out of that group alone, we managed to keep and identify about 178 people. Those are super transmitting events, and they actually create and spread and drive the infections. The second big level is that in many of the correctional services, especially maximum services, we had a number of people who actually were infected within that areas. There are villages which create these super spread events by actually having a number of people within that village. Obviously, most of our urban areas with a high overcrowding, high dependency areas, that also creates an ability to push. But I think our strategy is really targeted into that. So we're pushing a very clear strategy of a targeted intervention. These targeted interventions set up a fully permanent teams who are able to trace individuals and work with the job to close down a place which is a hotspot.
When we talk about the prisons, how much worse has the situation gotten?
I think it could have gone way out what we did, we found that a single person who went to a funeral, actually somewhere, get back to the prison, because of the lack of actually controls, this individual was able to infect many of the colleagues, and because these colleagues worked with prisoners in a very confined and overpopulated areas, it spread very quickly. But our intervention, together with the prison services, we were able to isolate those individuals, test almost all the employees of the prison, and making sure that where they had a contact with prisoners, those prisoners are tested as well, and then they are quarantined. I think the testing and isolation and quarantine is one of the things that has really helped us to keep the numbers, even though high, at the levels that we have.
Testing is one of the big challenges that you're facing in the Eastern Cape. In fact, we believe that a significant amount of testing hasn't been able to take place as a result of a delay in getting testing equipment to that part of the country.
No, this is true. What's actually happening is that it's really that we are running out of the reagents. There is a reagent that is used to extract the virus out of a specimen. That is a big problem. When you look in terms of the National Laboratory Services, in terms of gearing for testing, we have sufficient machines and we can do more tests. The province alone can do almost up to 10,000 tests a day, but our constraint is the availability of reagent. The second one was that we started, if you recall, we started with the mass screening and mass testing. We tested a lot of people then, almost about we screened about 1.6 million people, and we tested over 45,000. Our yield from those tests was low because we're not generous in our testing. What the strategy is now, limit the testing to where you can actually find the person with an infection. Limit the test where you can use to manage a patient, and prioritize people who need testing and make sure that your tests are actually prioritized. We think we're going to manage the demand and manage the supply as well.
Sure, I have to let you go, but the Eastern Cape in itself has also been one of the provinces that has been heavily criticized by your own healthcare workers for failure to provide adequate protective equipment, especially to nurses at local clinics that are having to treat patients who do have COVID-19.
Actually, this has been some of our biggest problems. You recall we had a number of what is called wild strikes. The problem in the province is not availability of PPE. We have sufficient PPE, and actually some of our social partners have agreed. But what's really affecting us is a severe fear of COVID and a very high level of misinformation that gets into the system, and visuals of Italy, US, and people wearing those gowns. And people really felt very vulnerable. And what we have really done, we've moved now to make sure that we are actually creating a system where in each one of the localities, we create a system that assures people PPE is available, and we work with the unions and make sure that the unions are on board. And we think that in terms of our projections, we have sufficient PPE for probably 3 to 3 months in most of the time. But what we also are finding is that if we don't really train our people well, if people are really unsure, if facts are not being used, there could be a very severe fear and with an irrational act at sometimes. We are working on this, most of our colleagues, to make sure that we are supporting our nurse practitioners. We value them very well, and I think we're starting to find people are starting to understand that the fears are way in excess. Just as a conclusion, we have less than 250 patients in our ward as we speak. Most of those are actually the places we have done for COVID are still not occupied. So it's not so much of a huge exposure, but we also went one step further. We're saying that no one should go to any place where there's a COVID patient without an adequate PPE. That's what I've said right in front, and I've told everyone, and if one pushes like that, they can report it to me.
All right, let's leave it there for